The issue of patient advocacy has really been pushed in the past few years, and patients are really encouraged to become partners in their care and to advocate for themselves. And I think this is very appropriate. I think what's essential for this to work in the benefit of the patients is that there's a sense of trust between the provider and the patient, and that the patient is prepared to respect what the physician says, not necessarily agree with, and the physician is prepared to respect what their patients want. And the physician should also be prepared to acknowledge that there's a lot of unknown in medicine. There's a lot that we don't know. And so the risk-benefit calculation is not always that clear. So this is where a frank discussion between the patient and the physician are. And the patient may be persuaded to do things against his will, as long as he understands and he is sure that the patient understands the risks and benefits appropriately. So he shouldn't slam his fist on the table and say, I'm not going to do the test. I'm a doctor. I know about this. I've been doing it for 20 years. It would take too long to explain it. But the same way, he shouldn't say, okay, whatever, I'll do the test because you're not going to go away unless I do it. It's a challenge. I think self-advocacy is very important, but I think good medicine advocacy by the physicians is very important. And it really behooves us as a specialty, as a profession, to have the highest degree of integrity. I think we really have to be able to make decisions that we would be happy to have on the front page of every newspaper, and to be able to defend them. And this is it's a big task, but it's really one that the public expect of us, and they have the right to expect of us. We are entrusted with their healthcare budget to a large extent, and it's important that we use it appropriately. We're also trusted with their health, and it's important that we steer that appropriately.